By the year 2040, which is just around the corner, by the way, roughly 78 million Americans will be over 65 years old. To put that in context, in the year 2000, that number was 35 million, roughly half, and in 1960, it was 16 million, roughly half again. It's a vast demographic shift that is going to shape our whole world, and healthcare will be at the epicenter. Hey everyone, welcome back to Startup Health Now, the podcast where we celebrate the entrepreneurs and the innovators who are transforming health. I'm your host, Logan Plaster. We talk a lot at Startup Health about this idea that the aging population is shifting the needs of the healthcare system. But healthcare for seniors isn't just about the care that older generation receives. For almost every older person with a health concern, there's an adult child who is worried and involved.
We have very, very busy schedules. We have our own families. What we want at 5 o'clock is a report that says, Mom's okay. She took her meds. This is what she's got on, the docket for the next couple of weeks. Here's how you can engage. Also, how are you doing?
Right now, they are treated like some kind of awkward add-on to the system. We don't quite know what to do with them sometimes. Avanlee Christine, my guest today, is on a mission to change that paradigm. With her platform, Avanlee Care, she is making it easy and seamless for family caregivers to be fully integrated into the healthcare of their aging loved ones. That's great for families because they can monitor mom's health and get her what she needs. But as Avanlee has discovered, it's also great for health plans, specifically Medicare Advantage plans.
If we can leverage these people in to help us do the things we need to do, we're going to make more money, save money, and have happier members and actually lift up the 54 million unpaid caregivers who are acting as the backbone of the healthcare system.
In our interview, we'll get into exactly what Avanlee Care offers, including their integrations with Walmart and Mark Cuban's Cost Plus drugs, and we'll unpack how unpaid caregivers could become the key to success for Medicare Advantage plans. Let's get into it. Avanlee Christine from Avanlee Care, thanks for joining me today.
Hi, thanks for having me.
I was excited to get this update because you've been very active with Avanlee Care, and you've been really looking at how to help Medicare plans reach folks better, improve the kind of care that they bring to older patients. But I want to kind of unpack how you're doing that, how you're thinking about it. Let's start with what Avanlee Care is, if it's changed, if it's gone through any evolutions over the last year, kind of just level set with us.
Yes. So, Avanlee Care, we help Medicare Advantage plans, and we leverage informal caregivers to essentially help improve the financial performance of a health plan. Avanlee Care originally started as an app that was B2C, kind of created for my mom, grandma, who were in Montana while I was in Manhattan, and really the only product on the market was Life Alert. And so my mom was about to enter the caregiving season of life again. And I just thought, well, I could build something. Well, build something turned into building our first product, building a platform that really did help the caregivers on resources, caregiving tools. You're entering the season of life. This is what you need. We integrated with Walmart, integrated Walmart groceries, OTC health and wellness products partnered with Mark Cuban's Cost Plus drugs, allowing for caregivers to have cheaper medications through the platform. And then we really found product market fit when we started to approach Medicare Advantage health plans, because these plans so desperately need to leverage all these informal caregivers in to help with, for example, you and I are siblings, have communication with the plan around mom's breast cancer screening, her annual wellness visit, what meds she's taking, if her meds are changing, what she's eating, having insight into the food. Because what's ultimately important is what we are trying to do fundamentally at the core of the company is, can we keep seniors happy, healthy at home for as long as possible? And can we help the 54 million unpaid family caregivers in this country with their well-being, resources, caregiving tools, helping them enter the season of life, but leverage them to the health plan, to the core system that really keeps mom healthy at home. Because what I remember just seeing in the last 10 years is, I always talk to someone and they're like, there's just so much fractured communication. mom's doctor says this, she says this, my sibling says this, a nurse says one thing. And I was like, let's just bring that all together, because with the way that Medicare Advantage is moving and how our healthcare system is moving, we don't have enough people going into the healthcare system to care for our aging population. So you and I are doing the work. Let's bring us in to make it easier for everyone.
I want to get into the Medicare side, but first, let's just make sure we really understand the product itself. You kind of mentioned affordable medications, maybe a way to communicate with other unpaid caregivers. Kind of give us exactly what the platform is today.
Yep. So our core functionality, we really focus on medication adherence and management. Separate of medication, making sure that people have the ability to get discounted medications and pharmacy fulfillment through the platform. Second is the really the logged health information between caregivers and care receivers. So that's tracking vitals like heart rate through Fitbit,
Okay.
syncing that data through Apple Watch and HealthKit, and then grocery order.
How do you organize that data?
How do we organize the data?
Yeah, yeah. Well, how is that kept on your app? And I'm just kind of curious how that then translates to a health record or how it gets sent to somebody else. Like, how do you sort of structure all of that health data?
Yeah, great question. So all the health data that we're syncing in through the Avanlee platform is essentially owned by the caregiver, I'm sorry, care receiver using the platform. Um, Everything like our integration into Walmart grocery, that data is essentially being pulled into the Avanlee Care platform. You're shopping on Walmart. You're in Avanlee Care. It's the same experience. You have access to order compression socks, apples, peas, pears, depends, and get that delivered to an aging parent in all 50 states. In terms of the data we're collecting from a like biometric health perspective, it's really interesting because, you know, with AI, which, you know, most, if you're not using AI, you're so far behind at this point, but being able to have insight and access and collect the data of what a person's eating versus and as well as what medications they're taking, if they're exercising, how their mood is doing, if they're saying they're significantly more down and depressed after taking a specific type of medication. And
Hmm,
so taking that and packaging it to the adult child to inform them on this is specifically how you can help your mom, or to a provider or a health plan of these are the things that we're seeing, and here's the areas that we, like with predictive analytics, think that something negative could happen to their health. So how do we intervene?
got it. Okay, so the value to the person, the patient, and their caregivers makes tons of sense. Now, you mentioned a minute ago that product market fit really came into focus with Medicare plans, Medicare Advantage plans, because there's this other layer. And I understand you just got back from a conference that really focuses on Medicare and technology.
Yeah.
So tell me what you learned there. Tell me how it kind of fits into your theory, your
Yeah.
your thesis.
My thesis. Okay. So um what I what I primarily heard from health plans was we don't have a caregiver strategy. We know that they're there. We know they exist. There, some of them are our primary point of contact with our members is their adult child. This is something that we need to wrap our heads around and start to implement, because health plans know that by engaging in the adult child who is already taking mom to her doctor's appointment or her wellness visit, having a way to communicate with that person is key for them from a savings perspective on multiple levels, which, you know, from star ratings, and I can get into that soon, but primarily what I want to like come back and focus in on is just the point that health plans recognize that they need to have a relationship with the informal caregiver, and that they lack necessary tools to leverage them in. So that was the one thing I heard across the board for multiple plans that were speaking. But two was the um, wanting to deploy app-based solutions into rural communities to help their members. And so that was one of the bigger issues, which is like something you see out in the Midwest, Rocky Mountain region, where I'm originally from, Montana, is you have a lot of seniors who are up on the high line, top of the state, and all the kids move down to the cool cities like, Missoula and Bozeman, and that's where they're raising their family, but they're still 3, 4, 5 hours away from their parent. And so getting them in for an appointment, here's a prime example. My great grandfather is 100 years old,
Wow.
still living on his ranch
Wow.
in Montana. And his doctor, his closest doctor, is 6 hours away.
No
So
way.
every time Earl has to go to the doctor, he is, we have to get him in. And so
Wow.
it's, yeah, it is, it's hard in states where you have
He's
just,
maybe an extreme case, but he's representative of a category of patient who has lack of access. You could live a lot closer and still have extreme lack
yeah,
of access. You might not have a car, right? You might have
yeah,
other barriers. Okay, so you went to, what was it called? Rise? You went
right.
to Rise. You heard sort of what you wanted to hear, which was that they saw the value in the unpaid caregiver, the family caregiver. They wanted to deploy app-based solutions. Good. That's good for Avanlee.
Yeah.
Um, why haven't they? Let's explore some of the wrinkles in this. Why haven't they done it? Are they prone to working with startups versus building their own system? Where do you see that going?
Yeah. So I think a lot of plans have deployed products. What I have learned in the last, 2 years in studying this market and starting to get integrated into the market and seeing, what vendors are out there is there's just so many like kind of like one trick pony type solutions. We're going to focus on med management, and then over here we're going to focus on X. Um, What's very interesting to me is there's also a deep frustration of like there's an app or a platform or a software for everything. And I really wanted to get away from that when we originally started Avanlee Care. I wanted us to be a all-in-one comprehensive solution. But what makes us unique and different, which most of these platforms, especially on the health plan side, really lack, is what we specialize in at the core is caregiver resources, support, and tools. Um, that's really what I've noticed a lack of. You'll find that when you build technology, you have to really build it for the end user. And our end user is an adult child who's in her 40s, 50s, and 60s, and an aging parent. But you want to make it sticky and useful. So you and I are at work all day. We have very, very busy schedules. We have our own families. What we want at 5 o'clock is a report that says, Mom's okay. She took her meds. This is what she's got on, the docket for the next couple of weeks. Here's how you can engage. Also, how are you doing? Let's track your mental health, your well-being. Do you have the time to take off from work?
Mm.
How far in terms of distance are you to your mom? Do you have the ability to get there? And so that's where I saw a very different opportunity and approach to this market was, can we go in and help the person living at home, the health plan, because it's just so broken on the healthcare system side, but also what about the people that are doing the unpaid work? How do
Yeah.
you better support them with technology?
So you just met with these folks at Rise. You talked to folks from Medicare. The ultimate outcome there is that there are new partnerships that are born that you can deploy what you've created to um, millions more people. What are the barriers to that happening? Are you in a competitive market? Are they choosing between you and other folks? Is it just a resource constrained market that they'd say, I'd love to use Avanlee, but I just can't. I got no money. What are the barriers there?
Yeah, so I think the barriers there on with health plans is just sales cycles are really long. But the cool thing is there's spots that you can work with, like with quality and risk prior to selling into these bid seasons.
Okay.
And so we've started to pick up traction. We're releasing a SOC 2 compliant product in like days, which is very exciting. The dev team is very tired. We have very short
Remind me
call.
what SOC 2 compliant is.
It's a type of security that your platform has, and then so it's kind of required to work with these Medicare Advantage plans.
Got
So
it. Okay.
takes about, if you're quick, 5 months, usually
Okay.
8 months
Okay.
to go through.
It's a
Pretty,
compliance barrier necessary for Medicare.
yeah, and it's pretty rigorous. But um the second piece to that is I'm encouraged because walking, studying the market, looking at products that have been available. And, the last couple of years have been very tough on tech companies, especially in the caregiving space. We saw a super rise of funding in 2021 and 2022. And then a lot of these companies could not find product market fit. And so we have, I believe, found product market fit. The employer side is very, lots of competition, very saturated. I did not want to go to the employer market, even though many VCs kind of thought, this is a quicker sell for you. The reason why, and I'm glad we didn't, is because although we could if we wanted to, not discounting people who are working. That's why I built this for my mom. But on the employer side, we have in the news in the past like 6 months, a lot of CEOs have come out and said, we offer a lot of benefits, but they just don't get used. And so I think we're going to see a cut back of benefits for that employers are purchasing for employees. And so what I really wanted to focus in on is, well, yes, this is for caregivers. How do we get to the senior? And how can we push the adoption for the senior and the caregiver? And I believe that path is through Medicare Advantage plans.
Okay. So you had an optimistic reception at this conference. You're starting to lay the groundwork with these plans. You're seeing the progress. What are the next steps, and where do you hope to be, let's say, a year from now?
Yeah. Next steps in a year from now. Hopefully I'll have taken vacation. But a year from now, we are gearing
Let's
up
not
to.
get ahead of ourselves. Let's not get ahead of
I know,
ourselves.
I know, I know, I know. A year from now, I think we'll be working with multiple Medicare Advantage plans, and I would like to see from a product standpoint deeper integrations with some of our larger retail partners in terms of vaccine scheduling through the platform. We've started to talk about that, in-store vaccine scheduling, and full pharmacy rollout of a couple more full pharmacy integrations through the platform. And yeah, I'm sure we'll have
What
closed around.
what are some of the data points? Obviously, you could present an amazing idea to a Medicare Advantage plan, and they might say, "Sounds great. We can't do it for a range of logistical, bureaucratic reasons, whatever." So you've got to come with the right data and the right, like, here's how I'm going to help you. What are some of the killer data points, things that they're looking for, where
Yeah.
you can help them in kind of like the perfect way?
Yeah, so great question, because why do health plans care about this? I would say number one, from a star ratings perspective, the number one feature in our platform from the beginning, even when we launched Avanlee 1.0 into the B2C market, was med management adherence. Uh, when we launched our first product amongst like 6,000 people, we delivered 125,000 medication adherence reminders. It was off the
Mm,
chart. So star ratings are weighted 3 times by medication adherence. And so
got it.
that's number one. Two, member retention and satisfaction. You and I having a relationship with mom and health plan to make sure she does certain things and ensure, a health plan is offering, wow, me, the caregiver, a product that lets me, manage my mental health, manage my ability to engage with them, make it easier to care for my mom. Satisfaction and retention is really important because members want to have health plans want to have their members for a long time. And then two, you have a healthy, strong relationship established with the children. Who's to say they won't come, and consider your health plan? So star ratings and the member satisfaction or retention. And I would say, third to that is really medication adherence, because the med management piece, as I said, is just so important. Having the full pharmacy delivery for families to ensure that medications are being shipped to a member that is probably going to have chronic conditions and on multiple medications. It's very important that their meds are being taken and that they have them readily available. And then lastly, which has always been, my dream and why I built this for my mom, is the integration with Walmart and having OTC and health and wellness products, having insight into what your mom, your dad is eating, making sure they have food, because food insecurity is a real issue for people in this country. But also too, the health plan having insight into what they're eating, and OTC health and wellness products. So that's that. I think that in terms of why do health plans care, it's really a full package deal of, if we can leverage these people in to help us do the things we need to do, we're going to make more money, save money, and have happier members, and actually lift up the 54 million unpaid caregivers who are acting as the backbone of the healthcare system.
Yeah, very interesting. I want to close by shifting gears. We've talked a lot about kind of go-to-market strategy, Medicare Advantage plans, but at the end of the day, you're trying to help caregivers. And so I actually want to finish by, hearing some of your thoughts about caregiving today, more on the personal side, having helped folks through your app. Do you have any sort of wisdom to share about people who might be in that sandwich generation right now, kind of worried about their parents, their aging loved one? Your advice for them, just like how to thrive in that environment in 2025.
Yeah, caregiving is tough, whether even it's, little kids, aging parents. My advice and what we do in our platform is, the first thing we ask is, who are the people in your life that we can add to the platform? Because you need a team of people around you. Do you have siblings? Do you have an aunt? Do you have an uncle? If you don't have any relatives, do you have a family member? Having somebody and pushing that community to come in is really, really important. They say it takes a village to raise a child. I think it kind of takes a village to care for an aging person too. I think I might coin that.
Yeah.
So,
Or to do anything great, or to do anything great.
yeah, to do it. Yeah, run a company, like all these things that we do. It really, we were created to have relationship with other people. And so I would just encourage people that if they're in this season, it's a tough season, but caring for an aging parent is an honorable thing to do. It's the right thing to do. And so I would just encourage you to get a community around you while you do it.
Very nice. Very nice. Well, Avanlee, thank you for the update. Keep pushing on what you're doing. You're addressing an important gap in the market, and I hope that these Medicare Advantage plans embrace it quickly.
Yeah.
I know these are long sales cycles, so even a plan that sees the value can be a challenge. And so I wish you the best in all of those processes.
Awesome. Thank you.
Thanks for listening to Startup Health Now. We'll be back again with another episode next week.